Did you know that frequent urination is a sign that you could be acquiring diabetes? Well, in this video we are going to look at some of the signs and symptoms that show that you could be developing diabetes. Hello our dear viewers, I am your physician Dr. Andrew, and thank you for tuning in. Welcome to our channel, Health Tips and Tricks. If you're new, kindly subscribe, and if you missed our previous videos, please check and view them to improve your health. Without any further comment, I will go straight to our question from our friend Muhammad from Nigeria. So to pick up, Muhammad had said that his grandmother had diabetes and he was worried that could he also get it. So he was asked, so what are some of the signs and things that may show that I'm getting diabetes? So we are going to see that diabetes is a disease which affects the entire body. Why? Because the entire body needs glucose to function. And we learned that diabetes is a disease which affects your body's ability to handle this glucose. So when you get diabetes and this glucose becomes too much in your body, it starts affecting your body organs. And it will affect all your body organs because all your body organs receive this glucose. So to look at some of the signs and symptoms, we could look at it starting from the head to the toes. So looking at the head, for example, some of the common things that you'll see, a diabetes patient will feel tired all the time. You cannot think right. When you start feeling, you're feeling tired, your concentration levels go down. That is a sign that you could be acquiring diabetes, because our brain is one of the organs that need glucose to function. So if the glucose balance is not okay because you have diabetes, your brain will be affected. Your brain will be tired. It is not getting the glucose it needs. So you will always feel fatigued all the time and you can't even think properly. You can't do your work. You can't concentrate at your work. Then looking at the eyes, diabetes affects the eyes. When you realize your eyes are no longer seeing properly, you look at something and you see as if it is cloudy. So that's also a sign that you could be acquiring diabetes. Why? Because in order for your eyes to see, you need the glucose. Then moving down to your chest, for example, you have again other things. You have the skin. You start getting, your skin starts becoming thin and soft. When you realize your skin is becoming thin and soft, your skin is easily bruising, then this is also a sign that you could be acquiring diabetes, because the skin also needs nourishment from the glucose you take. So if it's not getting it, then this could be a sign that you're getting diabetes. Then moving on to some of the inner organs of the body. For example, the heart, which is also in the chest. When your heart is not getting enough glucose, it means it cannot support your body. So again, it will also cause you to feel tired all the time. If you've been walking from your home to your workplace every day, you walk a short distance, you feel tired. Why? Because your heart cannot support you properly. So you generally feel tired and fail to do even your normal activities like washing, housework, walking to work. So all this becomes difficult to do. Then moving down, we go to your organ, for example, the kidneys. The kidneys are the ones which handle water in the body. They help it to urinate. So when you have diabetes and you have a lot of sugar in your blood, this will also be passed in the kidneys and will cause you to urinate a lot. So if someone is urinating frequently, every 3 hours you're going to ease yourself. Every 3 hours you're going to ease yourself. This is a sign that you could be acquiring diabetes. Even at night, you will wake up at night and you find that you're waking up 6 times to ease yourself at night, to pass urine 6 times. This is what we call nocturia, or frequent urination at night. This is also a sign that you could be acquiring diabetes. And still talking about, still in line with that, we should say that because you're urinating frequently, you're losing a lot of water. So you feel thirsty all the time. All the time you feel thirsty and you want to drink. You find someone is walking with a bottle of water. You have not been taking too much water, but all of a sudden you start feeling the urge to drink water all the time. You're feeling thirsty all the time. So this is also a sign that you could be acquiring diabetes. And remember, we said because you have diabetes, your body cannot handle glucose very well. So it means your different organs don't get enough glucose. They don't have energy. So you feel hungry all the time. You feel the need to eat all the time, to have something you're eating all the time, what we call polyphagia. And this is also a sign that you could be acquiring diabetes. Why? Because you have all this sugar in your body, but your body can't use it. What we call starvation amidst plenty. You have a lot of sugar in your body, but your body can't utilize it. So you feel hungry all the time. You want to eat and eat, and this is a sign that you could be acquiring diabetes. Then moving on to the limbs, the arms, we have already talked about weakness, but you'll also get other signs. Signs and symptoms that come about when the blood sugar starts affecting your nervous system. So in the nervous system is a system which helps us to sense, to feel pain, to do activities. It enables you to move your arms and even to think. So if your nervous system is affected by diabetes, diabetes will destroy the nerves. Once these nerves get destroyed, the nerves start giving you sensations that are not there. You start feeling things piercing you in your feet. You feel pins and needles. You start feeling burning in your feet, burning in your arms. Things moving all over your body, and they are not there. Why? Because diabetes is starting to destroy your nerves. So this could also be a sign that you have diabetes. And remember, because you're not feeding, you could start losing weight. Because your body is not getting enough nourishment, it's not getting glucose. You are eating the glucose, but it's not benefiting your body. Your body can't utilize it. You start losing weight. You lose the ability to make more tissue, to make your body grow. So you lose weight, you become very wasted and thin. And people look at you and say, what is happening? So losing weight is also a sign that you could be acquiring diabetes. On the other hand, some people gain weight, what we call obesity. Or if you are gaining weight at a fast rate, it could also be a sign that you could develop diabetes. Why? Because like we have already said, obesity is one of the things that make your body not to handle sugar very well, because your body will not respond to the insulin that is being produced. So then regarding also the body in general, the skin and other body parts, you could also start getting, for example, wounds that don't heal. Maybe you've been a farmer, you go to the garden, you dig, today you get a wound, and in 5 days you have healed and you're fine. So if you start getting wounds, maybe from small injuries, and these wounds take long to heal, that is also a sign that you could be having diabetes. Your body's immunity becomes weak because of diabetes, so you start getting infections all the time. Today you have pneumonia, tomorrow you have malaria, tomorrow you have a viral infection. So if you start getting infections and you're frequenting the hospital all the time, this could also be a sign that you're developing diabetes because your immune system has become weak. I hope this was helpful. Those are some of the signs and symptoms and early warnings that show that you could be developing diabetes. We have seen how it affects the different parts of the body and how this can show, right from things like feeling thirsty all the time, feeling hungry all the time, frequent urination even at night, losing weight, getting infections all the time, having these wounds that don't heal, among others. And when you notice these signs, know that I could be developing diabetes, and that's time to go to your physician and have your blood sugar checked so that you can begin treatment early in case you're developing diabetes. Thank you very much for listening. I remain your physician, Dr. Andrew.